Hi, this is Dr. Eric Westman with another edition of Adapt Case Files. After 10 years of clinical research, we opened the Lifestyle Medicine Clinic at Duke to use the keto diet for therapeutic use for diabetes, obesity, lots of different things. We've done studies on heartburn, polycystic ovary syndrome, irritable bowel syndrome, the list, fatty liver, the list goes on. One of the people I'd like to talk about today, though, is a gentleman who is on the list for a heart transplant. His heart was diseased from a disease called cardiomyopathy, so that the heart was not pumping very well. There's something called an ejection fraction, how much the heart actually squeezes and gets the blood to go around the body. And this was so low that he had to have a pump implanted to help the heart. So he was so sick from the heart disease that he had what's called a ventricular assist device implanted. You open the chest, you put the pump in, a tube goes into the heart, and then a tube goes into the aorta, the major artery that comes out of the heart. He had that placed several years ago in order to get on the heart transplant list. And so the purpose for these devices is kind of as a bridge to get people to a heart transplant if that's possible. Turns out that Duke has one of the biggest ventricular assist device, VAD or LVAD for left ventricular assist devices programs in the world. So I'm treating patients with a low-carb keto diet for diabetes, weight loss, and the heart surgeons start sending me their patients because the method I use doesn't require medication, doesn't require surgery, it's just changing the food. So this gentleman, of course, signed permission for me to talk about him. And he's actually thrilled with the progress and wants everyone to know about it. He started in April of 2016, so now that's about 2 years ago, at a weight of about 289 pounds. And now 2 years later, he's down about 40 pounds to 249. And while that might not sound like great progress, remember this is a very sick gentleman who's on 5 different antihypertensive drugs. He was on diabetes medicine at first, no longer on diabetes medicine, and he is on a blood thinner as well. So the kind of approach I use is a low-carb keto diet with the modifications of watching the vitamin K for the coumadin or warfarin levels, and also watching the salt so that there won't be any heart failure issues as well. Recurring theme, watch the salt if you have high blood pressure or a history of heart failure, even on a keto diet. So the therapeutic use, this is probably one of the sickest gentlemen, kinds of patients that I will see. I'm an internal medicine doctor and obesity medicine doctor, and using a keto approach therapeutically, it can be quite powerful. So now after 2 years, his diabetes is gone. His last hemoglobin A1C was 5.3% off of medication for diabetes. His exercise tolerance has improved, and they're actually thinking that maybe he doesn't need the heart transplant anymore. Now, that's a mixed blessing. Actually, the heart transplant is not a perfect fix. You have to stay on anti-rejection medication, often on prednisone and other therapies. It's a big deal. Of course, having a ventricular assist device is also a big deal. These patients come in and there is basically no pulse because the pump itself is a continuous flowing sort of machine, and you listen to the heart and you hear the whirring of the pump, not the heartbeat itself. It's again, these are probably the most sick people that you will see in a obesity medicine or internal medicine practice. So the plan, he and his wife come in every month or so, is to continue to lose weight, and he needed a little jump start. He got off track over the holidays. I've heard that before, but then hopped back on. And again, his heart function in terms of ability to exercise and walk and do things around the house, the yard work, he's thrilled with that already. but still has the left ventricular assist device in place. They're actually, in some cases, taking out these ventricular assist devices without heart transplants if the heart improves. And it turns out the heart can improve. It is a muscle that can remodel itself. So depending on what caused the damage, it may be that this gentleman with more weight loss will be able to not even have a heart transplant. And that is a pretty amazing thing, but just by changing the food. Remember the program I use, a keto kind of approach. He eats 2 eggs in the morning with coffee, black coffee and water. He has salad with deli meats and cheese for lunch, a salad and some green beans and a meat for dinner, some cheese, sugar-free Jell-O for sweet. He walks 7 days a week now for an hour, and that's basically how I monitor folks with the food and make sure they're getting good nutrition as they do this. So that's a pretty amazing case file of a gentleman with severe heart disease, such that he has an assist device implanted. He's losing weight, fixed the diabetes, still on medication, still has a ways to go, but that's one of the amazing things that can happen with the keto diet. I hope that's helpful, and please subscribe below to the channel so you don't miss out, and let us know your comments and questions.